It was in 2007, and we were in a situation where we had very high population growth, about 30,000 people a year coming in, and we were at the bottom in terms of funding, lowest per capita funding in Ontario. So we felt we really had to make choices which would not only be effective, but the most effective they could be in terms of public health programming. What we're trying to do, for those of you in the manager position, is actually we asked ourselves about the kinds of things that were preventing us from using research evidence in our program decisions.
We want to make sure the target is...
What we found was that we couldn't get access to research. We had no library service that would allow us to access research articles. Secondly, when we could get them, we couldn't consistently critically appraise them, decide what was high quality and what wasn't.
We wanted to look at the literature more comprehensively.
And thirdly, our staff said, we have no time for this. We have such heavy service demands. We really cannot take time to look at research evidence carefully.
I'm manager of the epidemiology team, and what my group does is process health status data. So we would acquire, analyze, and translate out to program staff.
I am the manager of infection prevention and surveillance, and as part of that portfolio comes communicable disease surveillance.
We spent a lot of time and energy creating health status reports, and it wasn't evident that they were being used to make program-related decisions.
What we were finding is that we were producing reports with surveillance and health status information, but that the use of that data was not being maximized.
If you're not using local, up-to-date, and relevant data to decide whether you should initiate a program, I think that would have implications for the resources then that we're putting into new program development.
And were they doing the screening, any of them doing it at the time of contraception? For my extra project, we developed a rapid review process that would allow us to rapidly identify critical pieces of research evidence for us and bring them into our decision-making processes.
Where we're at now.
The end result is that research definitely is being brought into the decisions in a very structured, concrete way that's helpful to us. It helps keep us on track with what the latest thinking is. And that's just very helpful, makes us more effective as an organization.
We'd like you to have a look at these. One of the first things that the extra training did was help us to focus our problem statement. Okay, so let's start with your group here. So that was the first hurdle. The second piece, now that we've identified what some of the problems are, which are skill and some of the organizational prompts that we have within Peel, is how do we then train people effectively? And how do we sustain that?
So let's take a look at your smoking prevalence graph. Part of our intervention project is to develop and to implement training sessions. And as part of that, we're imparting some knowledge around epidemiological terms and concepts. And what do you see in the second graph? But we know that from adult learning principles that that people won't necessarily connect unless they actually see data and use data that are directly relevant to their teams and the work that they do every day. So part of our training session is to build in an interactive component and get people working with data that they're familiar with.
We definitely want people to be using data to be making evidence-informed decisions. It's part of evidence-based public health.
There's an overall goal to improve or to build the skills in our workforce. If we have a strong, capable, educated, resilient, innovative workforce, then we can do our very best work.
I'm one of the nurses calling from the region of Peel.
Beal. I'm calling in regards to the Quit Smoking program you signed up for.
Because we do know now that there is no known safe amount of alcohol in pregnancy.
Okay. We're just checking the internal temperature. All hazard.
Everything we do in healthcare to make our health systems sustainable is valuable to us as an entire community. And there's no point ignoring what research would tell us. In fact, why not incorporate it, make better decisions, and free up some of those resources for other things that are really important to us all.